This conference will now be recorded.
Good morning, everyone. Thank you all for being here today. This is Melissa Moran. I'm the Public Information Officer for the Whatcom County Health Department. As folks are entering the meeting room, if you could just take a moment to change your profile name and add your affiliation if you haven't done that already. That would be helpful for us. Thanks so much. Just a couple of other reminders as we get started here. Currently, the chat feature is disabled. We're going to turn that on once we get to the start of our question and answer period. And at that point, we'll invite members of the media to type in if they would like to ask a question. Please also remember just to keep your microphone muted unless you've been called on to ask a question. And again, just a reminder that this meeting is being recorded, and the recording will be available later this afternoon on both the Whatcom County Government's YouTube channel and on our media page at www.whatcomcounty.us/COVID. And with that, I'd like to introduce Erica Lautenbach, the Director of the Whatcom County Health Department.
Good morning, everyone. I guess I just want to start by acknowledging what we learned on Friday about Washington's phased approach to returning to more regular business and personal interactions. I want to start by saying that we know the announcement that we've extended Stay Home, Stay Healthy until at least May 31st it's heavy for many of us. And like you, my colleagues at the health department feel the weight of these continued restrictions, not only on the behalf of the community, but for our spouses who aren't working, our employees who are missing their grandkids and their kids, and just the personal impact this is having on all of us. We want everyone to know that the feelings we're all having are real and they're valid. Having to disappoint your child and telling them they still can't play with friends, asking businesses to remain closed and workers to stay home, and reminding grandparents and other elders that they need to stay separated from others. All of this comes with a lot of hardship and strong emotion. As humans, we desire certainty and stability almost as much as interpersonal contact. We want to know specific numbers and dates because they give us a sense of predictability. And in the absence of those specifics, we have to cope with the stresses of so many unknowns. I'm sorry, my phone is ringing. I'm going to turn that down. So I was saying, in the absence of those specifics, we have to cope with the stresses of so many unknowns, and we have to keep adapting to new and changing information. We all want to go back to normal, and it's all too easy to want to waver in our commitment to staying home and staying apart. But it's worth it to remain committed to these actions. It's worth it because we're still seeing new cases in our community each day. In fact, you may have noticed, but we saw twice as many cases in the past week, ending May 2nd, than we had in the previous week, ending April 25th. This means the disease is still spreading and could continue to spread even more if we open back up too soon. Turning the dial toward opening back up is a shared responsibility, one we share with every part of our community. This includes Whatcom Unified Command, the health department, our healthcare partners, employers, and residents. So in terms of Whatcom Unified Command, they have stood up the isolation and quarantine facility, and it's ready to accept anyone who cannot safely quarantine or isolate. They continue to provide healthcare providers and first responders with PPE needed at the request from those facilities and from those entities. And the intelligence unit within Whatcom Unified Command is working with the health department data staff to track, monitor, and predict the spread of COVID-19. For our part at the health department, we are monitoring data, we're investigating and controlling clusters of disease, and we're providing direction to control spread of infection in workplaces, keeping you informed, and ensuring that continued testing availability remains. We're continuing our case and contact investigations, and generally at this point we're able to follow up with cases on the same day we're notified of their test results, and with their contacts within 1 to 2 business days, or well, actually every day is a business day, so 1 to 2 days. Our public health nurses and environmental health staff continue regular check-ins with long-term care facilities, consulting with them as needed, and we found and are very glad to report that there are no new outbreaks of COVID in any Whatcom County facilities, and all of our local facilities are taking the required precautions and working hard to prevent further spread. In terms of our healthcare providers and partners, they're testing and treating patients. We learned at our weekly Healthcare Coalition meeting last week that our county's testing capacity continues to be the same as we reported last week. About 2,400 specimens can be collected each week, with capacity to run tests on about 10 times as many specimens weekly as we are now. We are grateful to both Peace Health and Northwest Labs for just last week increasing testing for patients, which will help increase the overall testing capacity in Whatcom County. In terms of employers can implement best practices that keep employees and customers safe. And last week I talked about the Public Health Advisory Board task force that we're looking to convene. A subgroup of that Public Health Advisory Board met on Friday, and we reviewed more than 150 applications for membership. There were, I think, 164 individuals that applied to be members of this, which really tells me that there's a desire to have purpose, to have engagement, to be involved in solutions. And I'm just really impressed with our community. And that goes for not only businesses, but nonprofit organizations, faith community, our tribal partners, and others that want to be involved in the solutions. So tomorrow at the county council meeting, when they're acting as the health board, they'll meet and consider a resolution to create that task force we will call COVID-19 Employer Infection Control and Social Distancing Guidance. Upon confirmation to proceed, we'll confirm members this week, and meetings of the task force will begin this or next week. When it's time for more businesses to reopen, the work that is this task force does will help them do so with your health and safety as a top priority. This complements the broader work of our regional economic partnership as it works to support businesses, our community, and our local economy from a financial recovery and economic development perspective. And for our residents in the community, wear a mask, don't visit friends, family, or neighbors. We know that last week a number of our cases were associated with a cluster, and we see this happening, and we just want to remind folks not to visit friends and family because while you may be missing them, they could be carrying the virus, and that's a concern for us. And we're also asking individuals to please get tested if you're sick and have any of the symptoms of COVID-19, including the newly released CDC additional symptoms. And I'm just going to read those because they are a new addition to the guidance that we're giving. The existing are fever, cough, shortness of breath, or difficulty breathing, and sore throat. But the new CDC identified symptoms are chills, repeated shaking with chills, muscle aches, headache, and new loss of taste or smell. It's going to take all of us to turn these dials, and we thank everyone for doing their part. So with that, I will open it up for questions that you may have. And I'm going to turn my camera on so you can see me and we can interact.
So we've opened up the chat feature. If you'd like to ask a question, please go ahead and type in your name and affiliation. Looks like our first question is from Robert Mittendorf with the Bellingham Herald. Robert, go ahead.
Hi, Melissa and Erica. Thanks again for getting together with us this week. I'm not sure if you've looked at the weather forecast for later this week, but it's going to get really nice. Looks like we might get our first round of 70-degree temperatures this year in a year that so far has been fairly cool.
Mm-hmm.
Do you have any advice for people who are outside on the trails or walking in neighborhoods, etc.?
Sure. I think just really being mindful of practicing the social distancing measures. Masking is not a bad idea, especially when you're in neighborhoods where others could be walking on sidewalks, and keeping that distance, that 6 feet of distance. I did see the weather report, and there was part of me that was very excited about a 70-degree sunny day, and there was part of me that was very nervous about a 70-degree sunny day. So just really being mindful of practicing those social distancing measures. We don't discourage people from being healthy and from getting out on trails and going for walks. It's important for our both physical and mental health, but just practicing those safety and social distancing measures will go a long way.
Could I ask one follow-up?
Sure.
So I'm not sure if you saw, but there was a Facebook group posted over the weekend called Linden Freedom Parade, and they are requesting people to parade down Front Street in Linden to protest the social distancing measures that have been taken locally and statewide. The organizer's page has apparently been taken down by Facebook because it violated its standards regarding COVID-19, but wondering if you guys had heard about that and if you had anything to say in that regard.
Yeah, we have heard about that. And our executive, Sidhu, has been in contact with mayors of all the cities. And I've been in conversation with Executive Sidhu as well as our sheriff about that. Yes.
Okay. Is there anything, like, people are still talking about wanting to go? Is there any advice you can give them, or maybe people who don't want to be caught in a possible event where lots of people are around?
Sure. Well, this is a trend we're seeing all over the country, and like I said in the very beginning of my remarks, I recognize the hardship that this is causing people. I recognize how hard it is, both from a mental health and financial perspective, the toll that this is taking. And I also recognize that that people have a strong desire, like 164 people applying for the task force in 2 days. There are people that have a strong desire to feel purpose, to be part of a solution, to do something. There's a strong desire to do something. And what I ask is that folks who have a strong desire to do something fill out a volunteer form to help the health department so we can work together toward a solution so we can get back up and running, rather than being part of what could be a setback for our community by gathering large groups of people like the Linden Freedom Parade.
Thank you very much.
Yeah.
Our next question is from Denver Pratt with the Bellingham Herald. Denver, go ahead.
Hi, yeah. I was wondering if there was anything that you could tell us about the clusters that you guys have seen recently, and where those might have come from, like if they were just, some people that were hanging out with their family, or if they were associated with like a business or a gathering of some sort. That would be great. Thank you.
I'll let Melissa jump in as well, but my understanding it was associated with a social gathering. Melissa, do you have any more information that we can share?
We do know that we have seen clusters associated just with small private gatherings of folks getting together. That's been some of what we've seen. And it looks like our next question is from Oliver Lazenby with the Northern Light. Go ahead, Oliver.
Hi, thank you. My question was about the number of deaths in Whatcom County was revised downward from 28 to 27. Can you talk a little bit more about why that is, why the cause of death was determined to be something other than the new coronavirus?
Sure, Melissa, can you help out with that question as well?
Yeah, absolutely. So the way that we're getting information about deaths is coming directly to us from in some cases providers, in some cases from facilities, and we become notified of folks who have already tested positive for COVID-19 who then pass away. We then work on reconciling that information against the death records through death certificates that are filed through the state. And during that reconciliation process, if we determine that the primary cause of death was not related to COVID-19, then we'll revise those records. And that's really our standard practice for all causes of death. That's why oftentimes we're only able to report on causes of death after several months of that data being quote unquote cleaned as it goes through the process of reconciliation. So we expect that to continue as we go forward because we are getting notification about deaths through those different mechanisms, and it takes just a little bit of time for us to be able to go back and make sure that all of that data is truly accurate. And it looks like our next question is from Key Relia with the Herald. Key, go ahead.
Thank you. I had a quick question about, well, two quick questions. One with, you know, the cases now being more than 300, is there any movement toward releasing where these cases are occurring by zip code? And then my second question was about the amount of the capacity for testing that can be done. Right now we can do up to 2,400 specimens that could be collected weekly. And does each specimen represent one human being? Thank you.
Sure. To answer your second question first, yes, 2,400 tests on individuals. We're not assuming duplication or multiple tests. And the first question about, number of cases and being able to stratify that in or disaggregate it in certain ways, like by city or by zip code. I know that our data team is looking into that. There is more data that's available on the Whatcom County Health Department COVID site as well. And maybe Melissa, if you have any updates on where we are with further disaggregation, that would be helpful too.
No, I think as Erica described, our data team is really making sure as we go about sharing data that any of the combination of data that we present could potentially lead to identifying specific individuals. And they're back in the office today on Monday working on determining the appropriate time for us to share that data and looking at possibly different sub-county levels at which we could share that data. So whether that's by zip code, school district, or other geographic boundaries, we're working on that this week. And it looks like we have another question from Denver with the Herald. Denver, go ahead.
Oh, my question got answered, so I'm good. Thank you, though.
And I believe we have another question from Key. Did you have a follow-up there, Key?
I do, thank you. So Melissa, you had indicated that there are 2,400 tests on individuals that can be done each week. Do we have a complete number yet on how many actually are being done? Thank you.
Yeah, I think we referenced this last week in that not all of our local labs are reporting electronically into the Washington Disease Reporting System, which means that our negative results do lag behind just a little bit. So that does complicate our ability to report out on the total number of tests that happen. And I don't have a further update from our communicable disease and epidemiology team on that. There's also data available on the Washington State Department of Health's website. They do report out the number of tests each day, and that information can be further disaggregated to the county level. Again, their numbers may be slightly different than ours, just given the differences in reporting mechanisms out to them. So we do have a rough estimate from the Department of Health from their website, and we're also working to just close that gap a little bit here locally as well.
Yeah, I think that said from Melissa, we know there's more work to do from a community provider perspective in additional testing. And some of that is reminding folks, like I did in my remarks, that if they have symptoms, any of those symptoms, they can go and get tested by their primary care provider. And if they don't have insurance or a primary care provider, they can be tested by the health department. So making sure that folks know that testing is available, they should get tested. It's a powerful tool in our understanding of this disease, and also just continuing to work with our providers to test when they see those symptoms as well.
Oliver Lazenby with the Northern Light. Oliver, go ahead and ask your question.
Thank you. I was wondering if the number of people seeking tests has increased since the county changed recommendations, or at least publicized that anyone with symptoms could get testing, or if you know that yet. And if the capacity to test is more than the number of people seeking tests, is it possible that Whatcom County could get a drive-through site that doesn't require symptoms, as Skagit recently did?
My understanding from my conversation with the director at the Skagit County Health Department is that there are still requirements for symptomatic or for symptoms, unless they are in identified high-risk populations, like a pregnant woman, someone who has a pre-existing condition that could be exacerbated by COVID otherwise. So the health department here and the health department there are both doing drive-through testing. And I think the issue becomes when you start testing asymptomatic, how often do you test over and over again? What are the limitations in terms of insurance? Because the test is over $100. So there's just concerns about how often you actually want to continue to test people that are asymptomatic and don't ever show symptoms. So there's just sort of kind of some logistical and also practical considerations when we're also, we recognize that there's more capacity, but we also don't want to overwhelm the system and not be able to test folks who are symptomatic, because we've opened it up to asymptomatic individuals. So I think there's just some considerations that we're still working through.
Just to add to what Erica said as well, we are testing asymptomatic individuals who we know are close contacts of confirmed cases, or when there is a cluster or an outbreak associated with a facility. So when there is an additional criteria that lead us to believe that person could have had a direct exposure, we are testing asymptomatic individuals in those cases as well.
Thanks for that. I forgot to mention that. Thanks, Melissa.
All right, our next question is from Brent Lindquist with the Linden Tribune. Brent, go ahead.
Yeah, you guys actually answered both of my questions, so thank you very much.
Okay.
Great, thanks, Brent. And next up, we have Joe Tehan with KGMI. Joe, go ahead.
Thanks very much. Mine's more general, and I forgive me, I've been monitoring a couple of different meetings during this hour, but so if this was already covered, but we're hearing from the governor that we need to continue safe practices. We hear that from other officials far away, and I just wanted to. And we hear pushback all the time from people, or why are we continuing with this when the numbers are low at our local hospital and this sort of thing. I just wanted, I guess, Erica, to get from you, a local health official, what would you say to folks who are pushing back and are upset about the continued quarantine, or at least continuing stay home, stay healthy?
Yeah. Well, like I said in my remarks, and I'll say over and over again, we are not immune to the pressure, and we are not without empathy for the concerns that people have. We recognize that people are restless, that they want to get back to work, that they are under incredible financial stress, especially business owners. We recognize these things. We recognize that people are suffering mentally because they need physical and social connection with friends and family. We recognize all of these. And yet we know that an additional wave could result in further lockdowns, further stay home, stay healthy orders. Like the governor said, I think it's really important that we tackle this in a strong and swift way now, so we don't have to revisit some of these policy decisions in the future, and we can get people back to work. We can get people back to work safely, like the work of the task force, and we can move forward. We can move forward in a way that allows us to recover both mentally and financially from this. But now is not the time. We know that some small counties will be given variances potentially to move into the phase 2, and yet those are communities of less than 75,000 people who have not seen a single case in 3 weeks. And I just want to remind everyone that we have not yet had in how many weeks? 9 weeks. We've only had 1 day that has had 0 cases. So the idea of us getting from where we are now to 0 cases in 3 weeks requires a lot of effort on our part as a community, for residents, for employers, as those that are currently operating and those that hope to operate soon, for our healthcare partners, for our health department, and all the other partners that are working on this. If we can start to tackle this as a community together and continue to practice these safe practices, we can get there, but we're not there yet.
All right, it looks like our last question is from Key Relia with the Herald. Key, go ahead.
Thank you. So quick question for you. I think it was you who answered, Melissa, regarding the amount of tests that may have been done, if we even, in terms of being able to know how many there are. You had said that there was a rough estimate from the state, or that can be pulled from the state data, and I was wondering if you could share what that rough estimate is. And then the other question I had was for Erica, who last week spoke about beta testing for software that would help municipalities track people's movements. And I was just wondering if I could get an update on that, if there is one. Thank you.
Yeah, I'll go ahead actually and just drop a link to the state's COVID data dashboard into the chat feature. That's where the information is. They include the number of tests performed daily for the state as a whole. And there is an option there where you can select just Whatcom County and see the day-by-day numbers. The most recent data, they do make a note that it may be incomplete for the most recent data. Like I said, there's a bit of a lag in terms of being able to calculate some of the negative numbers for those most recent days. And then I'll go ahead and let Erica answer your other question.
Sure. I think the question you asked was about REDCap, which is a system that the state is testing with local jurisdictions so we can track those cases and their close contacts and those who may be exposed. And that will allow us to track folks who maybe work in Skagit County but live in Whatcom County, communicate with Skagit County, so we're all on the same page about who is doing what and where the exposures are, or other counties, or even just being able to enhance our ability to identify those cases and the contacts. I know that this work is coming soon. I think it's this week, but I don't have an exact date for you, and we can follow up on that.
And we do have another question from Seth Stevens with the Western Front. Seth, go ahead.
Hi, I was wondering, this after, I guess last night, there were reports of projections from the United States of expecting up to 3,000 daily deaths from the coronavirus by June 1st. With that being said, as we start to turn the dial and go into phase 2 and 3, eventually, does Whatcom County have any updated projections for what they expect could happen once we start reopening? Any rough estimates on that?
Yes, we update that information, and it's available on the Whatcom COVID website. There's a link to it on the right-hand side that has our latest model and projections. To answer your question, the beginning part of your question, I did see that article about another another surge of cases in early June or by June 1st. And I think that is more associated with states that don't have the same level of stay home, stay healthy order that Washington State has in place. I don't see in the next month a whole lot of change in terms of where we are now, given that nothing policy-wise has changed. Unless personal behavior changes, we are still in the same state policy-wise that we were last month.
We have a question from Key Ralia with the Herald. Key, go ahead.
Thank you. Related to all of us working together to move that dial, I see this complaint a lot, but is there anything that can be done from the regulatory side? Let's say if I'm driving by and I happen to see, which I did yesterday, what looked like a birthday party with children, and I caught one person wearing a mask, but others did not seem to be. Is there anything that a concerned member of the public can do under those circumstances? Thank you.
Yeah, the directors of all the local health jurisdictions meet and talk once a week. And one of the conversations we had last week was about masking and consistent masking policies, especially as businesses reopen. I think that is something that we're all sort of considering about where to go with a masking policy. We do recommend it, but at this point, it is just a recommendation. This won't surprise you, but the health department does not have enforcement capability at the moment to look into complaints of parties or other social activities. And I think as this month continues and we see more of that, further conversations need to be had with our enforcement partners to determine what the best way to handle these are, both from a human perspective, understanding that people want to get together and want to have celebrations and have social interaction, but also the safety risk that poses. So I think that's an ongoing conversation, Keith.
In addition to that, I went ahead and dropped into the chat a link, information that's available from the state coronavirus website, coronavirus.wa.gov. There's information there about folks who want to report suspected violations of the governor's order, whether that's regarding essential businesses or social distancing. And there is an option to report that using a tool set up by the state. So that information is also there in the chat feature. And also, as I said, available on coronavirus.wa.gov. And I believe that that is all of the questions that we have. So thank you everyone for joining us today and for your questions. Again, this recording will be available later today. Oh, I'm so sorry. It looks like we do have one more question, a follow-up question from Seth with the Western Front. Seth, please go ahead.
I just wanted to build off of the previous question. Are there currently any efforts from your organization to make masks more readily available to people who may not have the financial means to obtain one or just simply can't get one online, besides any sort of, community grassroots organizations that are kind of making masks for people? Are you guys implementing anything to make them, more available for people who need them?
That question is really a function of what our Whatcom Unified Command does. They're the clearinghouse for PPE, all PPE, including masks, and they take the donations of handmade masks and other masks that individuals have. Melissa, do you know if they're at the point where they're working directly with individuals rather than with first responders and healthcare providers?
That's a question we'll have to follow up on.
Yeah, I'm not sure about that, but we'll follow up.
Are there any more questions? All right, it looks like with that, we'll go ahead and end this call. Again, thanks everyone for being on. And as I said, this recording will be available later this afternoon on the Whatcom County Government's YouTube channel and on the Health Department's website at www.whatcomcounty.us/COVID. Thank you for attending.
This conference will now